the Chief of the National Defence Force, General Maphaha, members of the MCC and the PDSC, General and Flag Officers, Senior Officers, Officers, Warrant of the South African National Defence Force, Warrant Officers and non-commissioned officers, ladies and gentlemen. It is indeed my honor and pleasure as the Sergeant General of the South African National Defence Force to address you on this 2021 World AIDS Day commemoration of the Department of Defence. It is important to mark this day in our country and in particular our Department of Defence to not only commemorate World AIDS Day but to acknowledge the 16 days of activism for no violence against women and children that was launched on the 25th of November and ends on the 10th of December 2021. We use this day each year as an opportunity to strengthen our efforts to an AIDS-free generation, to show our support for people living with HIV and remember those who have passed away, as well as to take stock of progress made fighting the abuse and violence directed to women and children. I must say, we cannot commemorate World AIDS Day in isolation anymore. South Africa and the Department of Defence, and in particular the South African Military Health Service, has not been the same since the outbreak of the COVID-19 pandemic in 2019-2020. The COVID-19 pandemic and its impact on HIV and tuberculosis management cannot be underestimated. The human immune deficiency virus, HIV, and acquired immune deficiency syndrome, AIDS, epidemic is inextricably linked to the tuberculosis, TB, epidemic, and it's therefore often referred to as the dual epidemic of the HIV and TB. Where infection with HIV increases the risk of TB due to progressive immune deficiency, and infection with TB makes you more vulnerable to HIV infection. The HIV-TB dual epidemic is one of the most important public health challenges facing South Africa, with the impact of the epidemic clearly visible across all spheres of the society. As we all know, since March 2020, South Africa has been struggling to deal with the impact of COVID-19 pandemic, and the Department of Defence has been equally affected. Acknowledging that the quadruple burden of disease in South Africa, namely HIV, AIDS and TB, the high maternal and child mortality, injuries and accidents, violence and non-communicable disease, as well as now the COVID-19 pandemic, has also affected the Department of Defence. Thus, the SAMS has strategically implemented programs to manage these diseases optimally. The Department of Defence further accepts that HIV and AIDS, TB and COVID-19 pandemic are the main drivers of morbidity and mortality in South Africa, and consequently are mirrored as such in the Department of Defence. The mainstream of these three infectious diseases in the DoD is therefore vital in implementing strategies to reduce transmission of the infection, diagnose and treat early, as well as retaining patients on treatment and care are fundamental. The Department of Defence is committed to implementing high-impact targeted interventions that focus on the vulnerable military population in the fight against HIV, TB and COVID-19. The vision of the Department of Defence in terms of HIV and AIDS is to achieve a healthy and HIV-free military community. As such, the Department of Defence has been relentless in its mission to turn the tide of the HIV and AIDS and TB epidemics, as well as the COVID-19 pandemic, and there are significant achievements to celebrate. It is well recognized that the promotion of a healthy body and mind must be part of every soldier's armory. It is undeniable the one characteristic that differentiates us from the employees of any other organization. A healthy body is key in our pursuit to execute our tasks. There is excellent scientific evidence of the benefits of HIV treatment as prevention and progress towards cure and vaccine development globally and nationally. The SANDF is proud to state that our antiretroviral treatment program is on par with the international and national recommendations and contributes to the 1.5 million people living with HIV on antiretroviral treatment in South Africa. The SANDF has adopted the Universal Test and Treat campaign since the 1st of September 2016, as launched by the Minister of Health, and integrated the new antiretroviral therapy guidelines that include the use of integrase inhibitor and dolutegravir. The latest UNAIDS statistics from July 2021 show that there are approximately 37.7 million people globally living with HIV, 36 million adults and 1.7 million children under 15 years old, of whom 27.5 million, approximately 73%, are accessing antiretroviral therapy. About 1.5 million people became newly infected with HIV in 2020, and 680,000 people died from AIDS-related illness in the last year. At least 4,000 new HIV infections occur every day, of which 60% occur in the sub-Saharan African region. Approximately 84% of all people living with HIV knew their status. Of these, 73% are on IRT, and of these, 66 are virally suppressed, and there are about 1.1 million people did not know that they were living with HIV. So in total, since the start of the epidemic, about 74.9 million people have become infected with HIV, and 32 million people have died from AIDS-related illnesses. According to State South Africa 2021 mid-year population estimates, South Africa's mid-year population is 60.14 million. HIV and AIDS is the most serious health concern in South Africa. Our country has the highest number of people afflicted with HIV of any country, and the fourth highest adult HIV prevalence rate globally. UNAIDS dataset sourced from the World Bank shows Swaziland with a prevalence of 37%, Lesotho with a prevalence of 25%, Botswana with a prevalence of 25%, and South Africa with 19.07%. In South Africa, in 2021, there were approximately 8.2 million people living with HIV and AIDS. 240,000 new infections. This fell from 390,000 in 2010, and 71 people died from AIDS-related illness, a 50% decrease since 2020. The estimated overall HIV prevalence in South Africa is approximately 13.5%. HIV prevalence was 19.5% among the 15 to 49-year-old age group. South Africa has the largest HIV treatment program in the world, with approximately 5.9 million people living with HIV on antiretroviral treatment. UNAIDS 1990 targets envision that by 2020, 90% of people living with HIV will know their status. 90% of people who know their HIV positive status will be accessing treatment, and 90% of people on treatment will have suppressed viral loads. In terms of the 90-90-90 strategy, in 2021, 84% of people living with HIV knew their status of those. 73% were accessing ART, and among people accessing treatment, 66% were virally suppressed. In terms of the populations, the risk of acquiring HIV is 22 times higher among men who have sex with men, 22 times higher among people who inject drugs, 21 times higher than for sex workers, 12 times higher for transgender people. TB remains the leading cause of death among people living with HIV, accounting for around 1 in 3 AIDS-related deaths. It is estimated that 49% of people living with HIV and TB are aware of their co-infection and are therefore not receiving care. COVID-19 pandemic. The global COVID-19 pandemic has major implications for the world, and in particular, South Africa, with 8.2 million people that are HIV positive and immune compromised. The COVID-19 pandemic could not have come at a worse time for an economy and the health services already stressed to the limit. South Africa has been on lockdown under the Disaster Management Act since 16 March 2020. The current COVID-19 statistics for South Africa, 27 November 2021, are 2.9 million cases, 89,000 cases, and 96.3% recovery rate. To date, vaccines have been administered. South Africa is in the 4th wave of pandemic, and the predominant strain of variant is the Delta variant, with a new variant Omicron just identified on the 24th of November 2021 that has 32 mutations on the spike protein. This 4th wave of the COVID pandemic has led to a major impact, particularly in terms of the travel bans imposed to and from South Africa. The SAMS and all its military health units are preparing to manage HIV, TB, and the 4th wave of the COVID-19 pandemic simultaneously. Interestingly, with regards to HIV and COVID, a paper presented at the virtual 23rd International AIDS Conference by Dr. Marianne Davis showed data from the Western Cape province that HIV raises the risk of death from COVID-19 modestly, and around 8% of deaths from COVID-19 in the province are attributable to HIV, particularly people with higher viral load and a lower CD4 count than 200, and particularly those not on ARV treatment. However, it must be noted that although HIV prevalence in South Africa is higher, the number of deaths due to COVID-19 remains relatively small. The Department of Defense is equally affected. As a result of the strain on the South African healthcare system, the SAMS was heavily involved in the management of the COVID-19 pandemic in the SANDF and in assistance of the broader South African community. For example, troops were deployed to assist enforcement of lockdown regulations in Operation Notlela. The COVID-19 vaccination drive by the SAMS for its clientele is being intensified. The SG thus highlights the risk for the SAMS in managing HIV and TB together with COVID-19, as the healthcare professionals and other support staff are stretched to the limit managing COVID-19, and the shift in focus may result in neglect of HIV positive and TB patients. Military health units have been reminded to ensure optimum management of HIV and TB patients. For example, patients could not travel during the lockdown to pick up their antiretrovirals, which may lead to increased ARV resistance. But couriers have been used to deliver ARVs to the patients. There has been an impact on HIV management as the Global Fund to Fight AIDS, Tuberculosis and Malaria reported that, according to data collected at 502 health facilities in 32 African and Asian countries, HIV testing declined by 41% and referrals for diagnosis and treatment declined by 32% during the first COVID-19 lockdown in 2020, compared with the same period in 2019. In view of this, the year 2020-2021 was a key milestone for the Department of Defense in the fight against HIV and AIDS and COVID-19 pandemic. While the war is far from over, it is indeed important to acknowledge that we are winning some of the important battles. but there is no place for complacency. In the military, one of our principles is to maintain our effort and focus when engaging the enemy. We see AIDS as an enemy that is attacking our people, and we have to use all our resources to combat the enemy. One of the key areas where we deploy our resources is in the research environment. The South African Military Health Services has established a research capability since 2003. One of the first research projects was Project PDISA, a clinical research study to understand the impact of HIV and AIDS on the members of the South African National Defence Force. This project was unique in the world as it focused on members in the military. The results gave us a better understanding in terms of how and when to deploy people living with HIV and AIDS. Indeed, our policies in terms of the recruitment and deployment of soldiers living with HIV are groundbreaking in the world and are acknowledged by various militaries internationally. But while we acknowledge the tremendous strides that we have made in this fight, we also recognize the support that we in the SAMS have received from our members in the following and healthy, responsible lifestyle. We know that an informed and educated military is in a much better position to fight this scourge. I therefore want to take this opportunity to thank everyone for assisting the SAMS in this fight. I want to spend a few minutes on the value of voluntary medical male circumcision in combating the spread of HIV and AIDS. In fact, the National Department of Health officially added medical male circumcision to its HIV response as a key prevention strategy. This recommendation stated that medical male circumcision must be employed as an additional HIV prevention strategy in countries with low circumcision rates and high HIV prevalence. Ladies and gentlemen, medical male circumcision is a scientifically proven and cost-effective HIV prevention method. Research has shown that for every 5 voluntary male circumcision procedures performed in South Africa, 1 new infection is averted. Medical male circumcision, in combination with other prevention strategies, play a vital role in reducing the number of new infections drastically in the future. I'm therefore advertising all males to get circumcised. It is not only important for male prevention but also for general hygiene. It is recommended that male circumcision should always be considered as part of a comprehensive HIV prevention package, which includes HIV testing and counseling, correct and consistent use of male and female condoms, treatment for sexual transmitted infections, and promotion of safer sexual practices. I urge you to get more information from members of the SAMS when you consult at the hospitals and sick bays. I wish to applaud all the healthcare professionals for their enormous contribution to the management of HIV and AIDS, as well as TB and the COVID-19 pandemic in the Department of Defense. Ladies and gentlemen, one of our preventative actions, the distribution of military-specific camouflaged condoms, proved so popular that we are repeating it next year. We all know the value of condoms in the fight against HIV and AIDS. Despite our many advances, we still struggle to eliminate the stigma associated with HIV infection and the resultant discrimination. I would like to quote former President Nelson Mandela when he said, "Many people suffering from AIDS are not killed by the disease itself, but by the stigma surrounding everybody who has HIV and AIDS." Close quote. I therefore urge all of you to get involved, to recognize that HIV and AIDS is a chronic disease and that people living with HIV and AIDS can have a full and happy life. The UN AIDS global theme for World AIDS Day 2021 is "End Inequalities, End AIDS, End Pandemics." This global theme is highlighting the urgent need to end inequalities, be economic, social, cultural, or legal inequalities that drive AIDS and other pandemics around the world. Without bold action against inequalities, the world risks missing the targets to end the AIDS by 2030, as well as prolonged COVID-19 pandemic and a spiraling and economic crisis. 40 years later, that is since 1981 to 2021, the HIV pandemic still threatens the world since the first case was reported in 1981. Today, the world is off track from delivering the shared commitment to end HIV/AIDS by 2030, not because of the lack of knowledge or tools to beat AIDS, but because structural inequalities that obstruct proven solutions to HIV prevention and treatment. Tackling inequalities is a long-standing global promise. In 2015, all countries pledged to reduce inequalities within and between countries as part of the Sustainable Development Goals, SDGs. The Global AIDS Strategy 2021-2026, and Equalities, and AIDS, and the Political Declaration of AIDS adopted at the June 2021 UN High-Level Meeting on AIDS have ending inequalities at their core. Tackling inequalities will advance the human rights of key populations and people living with HIV and AIDS, make societies better to beat COVID-19 and other pandemics, and support economic recovery and stability. Fulfilling the promise to tackle inequalities will save millions of lives and will benefit society as a whole. But ending inequalities requires transformative change and committed leadership. Implementation of these policies requires bold leadership. Government must move from commitment to action. It is for government to keep their promises. They must act now and must be kept accountable, and so too must the DoD. If we do not reshape our AIDS and pandemic responses urgently on these lines, the list of deadly pandemics will continue to grow, thereby needlessly claiming lives, holding back socio-economic development and ruining communities and societies. If we do, the results will be repaid in terms of human health and development. It is therefore extremely important in the awareness of the DoD World AIDS 2021 commemoration to highlight the role of the DoD community in advocacy to help address inequalities and unite in the fight against HIV, showing support to people living with HIV and AIDS, and remembering those that died. The South African World AIDS theme for 2021 is, I quote, "Working together to end inequalities, AIDS, TB, and COVID-19, close quote, and it is informed by the global theme. I emphasize the need to test, to vaccinate, and to adhere to treatment for HIV and AIDS and COVID-19. The rationale is based on the South African Strategic Plan for HIV, STIs and TB 2017-2022, that serves as a roadmap for the next stage of the country's journey towards a future where these three pandemics are no longer public threats. The country has made significant progress in the efforts to respond to HIV and TB. Hand in hand with this is the launch of the 16 Days of Activism for No Violence Against Women and Children, an international awareness-raising campaign that takes place every year from the 25th of November to the 10th of December each year. The South African theme this year, open quote, the year of Charlotte Manya Matleke, 16 Days of Activism, moving from awareness to accountability, close quote. That urges all of us to fight the scourge of violence against women and children. The 16 Days campaign forms the center point of government's comprehensive 365 days of activism for no violence against women and children. Ladies and gentlemen, in conclusion, I would like to state that it is only when everyone is involved that we as a nation will grow. We all have a role to play. We are therefore tasked to urgently make the global threat of HIV and TB as well as COVID-19 pandemic a thing of the past. Let us stand together and win this all. It is in our hands to end HIV, TB, and STIs as well as COVID-19 pandemic. So, let us take hands to win this fight. Let us get to zero. The DoD is committed. Let us work together to end AIDS by 2030. I thank you.